name is Cassie Meyer. I'm a nursing student at the University of South Alabama, and today I'm going to be inserting an NG tube into your nose today, if that's all right. Okay. So I'm going to go ahead and perform hand hygiene and check my order form to make sure that this is supposed to be happening to you. And I do see it on here, so we're going to go ahead and proceed. And I'm checking my hospital policies and procedures. And I'm also going to check on your wristband the date, two patient identifiers. So Jaguar J. Jones is full name on the order form, and Jaguar J. Jones is on the wristband. Your date of birth is 8/25/1963, and 8/25/1963 is on your wristband. And I see on both your wristband and the patient order form you have an allergy to penicillin. Do you have any other allergies? No. Okay. Well, I want to let you know that we have privacy in here, so you don't have to worry about that as we continue. So next thing I'm going to do is gather my equipment and don my goggles, and I have my equipment here. So I'm going to go ahead and perform hand hygiene, and I'm going to raise the bed to a comfortable working height and lower the side rails. And I'm going to go ahead and assess your vital signs. So I'm gonna also take your bowel sounds. I would never do this over a shirt, but I would do it through under the gown. And I can hear your bowel sounds, so we're gonna go ahead and move to the next part. I'm gonna put oxygen saturation measurement on your hand, Mrs. Jones, so I can measure that throughout, and your vital signs seem okay. So one reason that I would not do the procedure is if there were no bowels, or if the oxygen saturation level was low, or the vital signs were deteriorating, and I would wait for the patient to be more stable before proceeding with the procedure. And the next thing I'm going to do is position the patient in a high Fowler's position. And I'm gonna go ahead and tell you, Mrs. Jones, that if at any point during the procedure you need to stop, just raise your hand, and I'll stop the procedure. Okay, so next I'm going to get my package and open my Salem Sump package, and I'm going to put a dollop of lube on the inside of this to use for later, and I'm going to go ahead and prepare my tape. So I'm gonna have 4 pieces of tape, one to mark to temporarily mark the measurement of how big the NG tube is, so I can pull that off, or how long, the correct measurement of the NG tube, and then another piece of tape for temporarily securing it to her cheek, and another piece of tape for across her nose with the date and time, and then the last piece of tape is for securing it to her nose after I've checked placement. Okay, so this is how I did my tape. It's a little uneven, but I cut down the middle, and so it's like a bridge. Okay, so next thing I'm going to do is put on my clean gloves. And go ahead and assess the patient's patency in their nares. So Mrs. Jones, what I'm going to go ahead and do is cover one nostril and breathe normal, and the other. Okay, so her right nostril is more patent, so that's where I'm going to insert the NG tube. And next thing I'm going to do is measure how the nasogastric tube from nose tip to ear. And since I'm on her left side, I'm gonna measure it on her left side. So from nose tip to earlobe and to the patient's xiphoid process. And I would never measure this over a patient's gown, but actually under the patient's gown. So I marked my spot, and I'm gonna place one of my pieces of tape here on the underside of that. Okay. And I marked where I'm going to stop when I insert the tube. Oh, well, actually, I'm going to put this in my jar. And now I'm going to loosen my syringe and put that in my basin, and I'm going to put the basin on my patient's chest, and I'm going to put a towel across their abdomen. Okay, so now I'm going to ask you, Mrs. Jones, to take your absence. Okay, so now I have fake Mrs. Jones and towel. Okay. Okay, so the first thing I'm going to do is put some lube on my suction tube. Well, first I'm going to coil it around my fingers and then release, and then loop the tube up to 4 inches and place that in there. And I'm gonna tell my patient to extend their neck against the pillow, and I'm about to insert it, and tell me if they're uncomfortable. And the first thing I'm gonna do is insert it into their nose, down towards their ear, and in like a downwards motion for 4 inches, or not 4 inches, and until I hit the nasopharynx. And once I do, I will begin telling my patient to look downward and relax their neck and look down, and take small sips of water as I advance the tube 1 to 2 inches each time, and rotating it 180 degrees. And as I do that, I'm gonna assess the patient's vital signs and make sure they're not coughing, and if they are, then I would discontinue inserting the tube and pull it back up to their nasopharynx to make sure that their breathing is fine before continuing. And then once their breathing stabilizes, I would continue inserting the tube. And and I would also stop if they were coughing as well. So the whole time Mrs. Jones has been taking small sips of water. Now I'm going to temporarily secure it to her cheek. Okay. And now that it's temporarily secure to her cheek, I'm going to check the placement of the tube with my tongue blade and light. So I'm going to look in her throat and see if I can see it, and it is in there. I'm also going to check the placement by connecting this to the suction. Yes. Right? Yeah. Okay. This has moved. It seems to be in there. Okay. So I'm going to connect it to the suction and aspirate gastric contents. And I would look at the contents and see what color it was to check for correct placement of the tube. And then I would also check the pH of the contents, and then if it was ordered, I would perform an x-ray on the patient. So now I'm going to mark with an indelible marker where the patient was supposed to have the NG tube at the latest, and then I would take out the marker around the nose, or the temporary tape placement on the tube. And there's still some. Okay. And next I'm going to take off the temporary tape on her cheek and on the patient's nose, which I've already cleaned. Place one part of the tube across the bridge of the nose and the other part of the tape on the tube. If my gloves were not so big, this would be easier. Okay, so this allows for the nares not to be harmed. And so I have one piece of tape at the bridge of the nose, and then it's going down and it's connected to the tube that's coming out. So next I would do is clip the tube of the patient to the patient's gown, so that according to hospital policy, and that way so there's tension on the head. Oh, okay. And I think that is everything. The next thing I'm going to do is connect the Salem sump tube to suction if it's ordered. And so I would connect it to suction that's connected to the wall, and my setting would be low intermittent suctioning. And if suction was not ordered, then I would cap the blue pigtail into the tube and place it over at a level higher than the patient's stomach, but low intermittent suctioning is ordered, so I'm going to recap it and place it above this patient's stomach. Okay. Okay. Now I'm going to make sure everything's okay and clean up my area. And I'm going to place my patient's head of bed no lower than 30 degrees, and I'm going to have the side rails up, and I'm going to tell them, or 3 of the 4 side rails up, and then I'm going to tell them that the call bell is right within reach, and so are all their personal belongings. And then I'm going to lower the bed all the way, and then I'm going to clean up and document. So I'm going to take off my clean gloves and throw them away, and I'm going to document the type and size of the NG tube, how the patient handled it, how it was secured, how it was placed, and the colors of the gastric content, the characteristics of it, and the amount, and how the patient handled it, how it was secured. And also I would make sure that on their nose I put the time and location, the time and date of the insertion of the tube, and I would also mark that on my document, the time and location and the size. I think I said everything. Okay. Time and location, how big the tube was. Location as in which nair. Okay. How secured, how the patient handled it, okay. Yes, I think that's all. And now when I come back to take it out, I'm going to assess my MAR again. I'm going to make sure that I'm supposed to take out my patient's nasogastric tube. I'm going to let them know that I'm taking it out today, and then I'm going to put on clean gloves. And then I'm going to order gloves, clean gloves, take it out, towel. I'm gonna have my towel here in my basin. So next what I'm going to do is first disconnect the suctioning to the wall and place that in my basket, and then I'm going to unclip it from the patient's gown, and then I'm going to take off the tape and disconnect the tape from the patient's nares. And what I'm going to do is tell the patient to take a deep breath and hold it, and while she is holding it, I'm going to slowly and carefully take out the nasogastric tube. And kinking it so that if there's any emission, it would stay in this area. So now it's in here. I'm going to take this and clean it up. And then I would document for one last time the drainage, like what came out of the patient's nose and the amount, and document how the patient handled it, and that is everything. Okay,